Cancers are increasing across the world as well as in India. And in the past few decades, the risk of developing cancer is gradually on the rise. There may be many factors behind this: increasing age expectancy, better diagnostic abilities, environmental factors, to name a few. But is the cancer word to be dreaded anymore? Are there any changes that has benefited the mankind? Let's talk about robotic surgery. Hi, I'm Dr. Arun Kumar, Urology Consultant and Managing Director, Asian Institute of Nephrology and Urology, Chennai. Nearly 20% of all cancers are urological in origin, especially the kidney, the prostate and the bladder. The most difficult thing in managing these cancers these are really deep inside the human body and not very accessible for any small operations. Doing any surgery in any of these organs, the kidney and the prostate, is a nightmarish of an experience. You need to make very large cuts on the human abdomen to access these organs, to surgically remove them. The C word, cancer, is a dreaded word for patients and doctors alike. None of us want to see patients suffering from cancer, and when we get patients, to see them suffer in cancer is not an easy experience for us also. But the management of cancer has undergone a paradigm shift in the last 2 decades, and we are more or less conquered most of the cancers, and these patients are now expected to live a normal life with a good quality of life also. Fortunately, most of the urology cancers are completely curable if picked up at the right time at a very early stage. And all our modern diagnostic services like MRI, CT has really enabled to pick up these patients very early in the disease process, which gives them a total permanent cure if surgically treated at the right time. Even 10-15 years ago, during my training times, all these surgeries were all really major surgeries, and most of the patients used to spend days and weeks in the hospital recovering from the major cuts and the major operations they had to endure to have these cancers removed. Kidney cancers, prostate cancers, they were all really major surgeries with a lot of blood loss, and patients' recovery was prolonged, and it was not only a recovery process was slow, but the patient's ability to return to work and their recovery was a stormy process. It all changed about 10-15 years ago when robotic surgery slowly started to pick up in the West, and we could see the sea of change that the robot could offer us in helping these patients to recover fast and have the surgery with great precision. Although keyhole surgery was there for many years, especially laparoscopic surgery, the results of the surgery was quite variable, and it was really technically demanding, especially in complex cancer cases. However, the robot changed all of this. We were really excited when we saw the robot performing intricate movements on our command, mimicking our hands inside the abdomen, going into areas where human hands struggle to go in, doing all the complex work with small minimum movements with great precision. This changed cancer treatment surgery completely. There were few years ago, not even long time ago, when patients had an open surgery for prostate cancer, they used to stay in the hospital for at least 7 to 10 days, recover for about a month. And would you believe that now most of the patients are being discharged on the first and second post-op day, and they get back to work within a week's time? This was all possible because of the complex, precise work that we could achieve through tiny holes, thanks to our robot. The other major advantage of robots we are seeing in kidney cancers. Traditionally, these cancers needed a really large cut to operate on them, and it had always been removal of the entire kidney for many years. Now we understand that we don't have to remove the entire kidney in small cancers, which are diagnosed quite frequently nowadays. We just need to remove the cancerous part of the kidney and save the kidney. This especially helps patients with diabetes and hypertension, where their kidneys are already slightly damaged, and saving their kidneys makes a sea of difference to their lives. Recently, we had a young man with tumors in both the kidneys. Traditionally, few years ago, we could have removed both the kidneys, and this patient should have ended in a dialysis. Imagine the plight and the difficulties and the life the patient had to endure if that would have been the case. But thanks to the robot with its finesse and precision, we were able to remove only the cancerous part of both the kidneys, save nearly 70 to 80% of the kidneys, and he is now living with normal renal functions. In his follow-up, in his scans, we could not even make out that he has had surgeries on both the kidneys because both of them look completely normal. Besides these, the other organs of the urinary system like the adrenal gland, the bladder, the testis, the penis can all develop cancers, and this also requires very complex surgical work. And again, thanks to the robot, we are able to achieve this with great precision. You need to understand that I'm talking about robotic surgery only for some cases where surgery is going to be the cure. But that doesn't mean that there is no cure for other cancers or advanced cancers. The key point in robotic surgery and the surgical treatment of these cancers is that you have to diagnose these cancers early, because that makes a world of difference to the prolongevity and the prognosis of the patient. But that doesn't mean that if you have an advanced cancer, we cannot treat you. The modern medicines are not only chemotherapy, but there are a lot of agents that target cancer at molecular level, and this is making a huge difference in the lifestyle and the prognosis of these patients. In the Western world, 95% of all patients who undergo surgery for prostate cancer have it done with a robot. So Da Vinci robot has really revolutionized prostatic cancer surgery, and it has now come to a situation where that is the only option and the best option for prostate cancer patients who have early prostate cancer. The advantage of robotic surgery happens when your cancer gets diagnosed very early. Make sure you visit your family physician or your general practitioner and get your bloods and your annual ultrasound scan to make sure that everything is in shape. For those unfortunate ones who could not get their cancers diagnosed early and suddenly get a huge shock that they have an advanced cancer, please remember that most of the cancers are now being treated very successfully with medicines, and please get that fear out of your mind that it's a terribly fatal disease. We are one of the few single specialty centers to have the Da Vinci robot, and we are highly subspecialized in managing urological cancers with our uro-oncology team. Not only cancers, we have a very highly specialized team of pediatric urologists, reconstructive urologists, and urogynecologists who also perform surgery with the Da Vinci robot for various conditions.